Good day, ma'am. We are the Group 6 and we are now reporting about the commonly abused substances. Since the beginning of human history and before, people have found ways to alter their bodies and their consciousness by taking substances such as herbs, alcohol, and drugs. Out of this practice has sprung many important contributions to science and culture. Prominent among them being the development of modern medicine and the medical profession, the making of fine wines and liquors. Some religions have found uses for mind-altering drugs as way to aid communion with the divine principle. For all the positives that mind and body altering substances have brought us, one fact is clear. There have always been people who were unable to restrict their use of mind and body altering substances to culturally prescribed limits and who have fallen into the trap we know today as addiction. Substance abuse can simply define as a pattern of harmful use of any substance for mood-altering purposes. Substances can include alcohol and other drugs, illegal or not, as well as some substances that are not drugs at all. Abuse can result because you are using a substance in a way that is not intended or recommended, or because you are using more than prescribed. To be clear, someone can use substances and not be addicted or even have a substance use disorder as defined in the Diagnostic and Statistical Manual 5th edition.
So good day everyone, I am Aljo Garde from Bped 3B. So this is my report. Definition of terms. In this paper, a substance is defined as any psychoactive compound with the potential to cause health and social problems, including addiction. These substances may be legal. Example, the alcohol and the tobacco. The illegal example are the heroin and the cocaine, or controlled for use by licensed prescribers for medical purposes such as the hydrocodone or oxycodone. Example, the OxyContin, Vicodin, and Lortab. These substances can be arrayed into 7 classes based on their pharmacological and behavioral effects. The nicotine, cigarettes, vapor cigarettes, cigars, chewing tobacco, and snuff. So here are the following substances. Alcohol, including all forms of beer, wine, and distilled liquors. Cannabinoids, marijuana, hashish, hash oil, and edible cannabino. The opioids, heroin, methadone, buprenorphine, oxycodone, Vicodin, and the Lortab. And also we have depressant, benzodiazepines, Valium, Librium, and Xanax. And also the barbiturates, stimulants, cocaine, amphetamine, methamphetamine, methylphenidate, and also the halogens, and also hallucinogens, LSD, mescaline, and MDMA, or the ecstasy. So that's the cover of my report. Thank you so much.
Good day everyone, I am Herin Foss and the next topic is the side effects of drug addiction. It may include a weakened immune system, increasing the risk of illness and infections, nausea and abdominal pain, which can also lead to changes in appetite and weight loss. Increased strain on the liver, which puts the person at risk of significant liver damage or liver failure. seizures, stroke, mental confusion, and brain damage. Problems with memory, attention, and decision-making, which make daily living more difficult. Global effects of drug on the body such as breast development in men and increase in body temperature, which can lead to other health problems. Effects of drug addiction on the brain. All drugs such as nicotine, cocaine, marijuana, and others affect the brain's reward circuit, which is part of limbic system. This area of the brain affects instinct and mood. Drugs target this system, which cause large amount of dopamine, a brain chemical that helps regulate emotions and feeling of pleasure to flood the brain. This flood of dopamine is what causes a high. It's one of the main causes of drug addiction. Although initial drugs use may be voluntary, drugs can alter brain chemistry. This can actually change how the brain performs and interfere with a person's ability to make choices. It can lead to intense cravings and compulsive drug use. Over time, this behavior can turn into a substance-dependent or drug-alcohol addiction. Alcohol can have short and long-term effects on the brain and disrupts the brain's communication pathways. This can influence mood, behavior, and other cognitive functions. Brain damage may also occur through alcohol-induced nutrition deficiencies, alcohol-induced seizures, and liver disease. In pregnant women, alcohol exposure can impact the brains of unborn babies, resulting in fatal alcohol spectrum disorders. It is reported that alcohol-induced brain problems can often be corrected with proper treatment. Abstinence from alcohol for months or years can help partially repair thinking abilities like memory skills.
Drugs' effect on behavior. Substance use disorder can lead to multiple behavioral problems, both in the short and long term, which can include paranoia, aggressiveness, hallucinations, impaired judgment, impulsiveness, loss of self-control, and addiction. Effects of drug abuse on unborn babies. Illicit drug use poses risk for pregnant women and their babies. Drugs may contain impurities that can be harmful to an unborn baby. Pregnant women who use drugs may be more likely to harm the fetus with risky behaviors and poor nutrition. Drug use can lead to premature birth or low birth weight. It can also cause the baby to have withdrawal symptoms, sometimes in the form of neonatal abstinence or abstinence syndrome, birth defect or learning and behavioral problems later in life.